A recent report from the World Health Organization has raised serious concerns about the declining use of condoms among sexually active teenagers across Europe. The data, collected as part of a large-scale study between 2014 and 2022, shows a clear and alarming trend. Fewer young people are using condoms, increasing their risk of sexually transmitted infections and unintended pregnancies. These findings highlight significant gaps in sexual education and access to contraception, raising urgent questions about the effectiveness of current health policies. The statistics paint a troubling picture. Over the past 8 years, the percentage of teenage boys using condoms during their last sexual encounter has dropped from 70% to 61%, while for girls, the decrease is from 63% to 57%. Even more concerning, nearly a third of all sexually active teenagers report using neither condoms nor birth control pills, leaving them completely unprotected. Socioeconomic disparities also play a role, with teenagers from lower-income families being less likely to use any form of contraception compared to their wealthier peers. This pattern suggests that financial and educational barriers are preventing many young people from making safe choices, further widening health inequalities. The consequences of unprotected sex at a young age can be profound and long-lasting. The risk of contracting sexually transmitted infections, including HIV, is significantly higher without protection. Additionally, unplanned pregnancies can derail young people's education and career prospects, limiting their opportunities for the future. The WHO warns that the lack of proper sexual health education is exacerbating these issues, as misinformation and stigma continue to prevent teenagers from accessing the knowledge and resources they need. In some countries, efforts to provide comprehensive sexual education have faced political and cultural resistance, leading to a dangerous gap in awareness and preparedness among young people. Experts stress that reversing this trend requires immediate and sustained action. Governments, educators, and healthcare providers must work together to implement evidence-based programs that provide teenagers with accurate information about contraception, consent, and healthy relationships. The WHO emphasizes that comprehensive sex education does not encourage sexual activity, but rather equips young people with the tools they need to make informed and responsible decisions. Without these resources, teenagers are left vulnerable to preventable health risks that could have lifelong consequences. The declining use of condoms also places additional strain on healthcare systems. Rising rates of sexually transmitted infections lead to increased medical costs, while unintended pregnancies require more support services for young parents and their children. Investing in sexual health education and access to contraception is not just a matter of individual well-being. It is a public health priority that affects entire communities. Despite the concerning trends, there is still an opportunity to address these challenges. The WHO report outlines a clear path forward, calling for increased funding for sexual education, better access to youth-friendly healthcare services, and open discussions about sexual health in schools and families. Governments must take responsibility for ensuring that all teenagers have the knowledge and resources to protect themselves, regardless of their background or circumstances. If these issues are not addressed, the consequences will be severe. Without intervention, the rates of sexually transmitted infections and unintended pregnancies will continue to rise, placing more young people at risk and straining public health resources. The current decline in condom use should serve as a wake-up call for policymakers, educators, and parents alike. Ignoring this trend will only lead to more preventable health crises and lost opportunities for young people. The time for action is now, before these alarming statistics become an even greater public health emergency.